Have you ever wondered why your doctor recommends the same tests year after year, even when you feel perfectly fine? What if I told you that after the age of 70, some of those routine medical checkups could actually put your life at risk? It sounds impossible, doesn't it? But here is the shocking truth that most doctors will not tell you. A groundbreaking study published in the Journal of the American Medical Association revealed that older people who underwent certain routine examinations had a 35% higher risk of serious complications than those who did not have them. This is not about isolated cases, but a phenomenon that affects millions of older adults every year. And throughout my 30 years of practice, I have witnessed a deeply disturbing phenomenon. The same system that is supposed to protect your health can sometimes become its greatest threat, especially after the age of 70. Today I'm going to reveal 5 specific medical tests that could be quietly harming your independence, your peace of mind, and even your life expectancy. Before we begin, I need to know if you are ready to join me on this journey. If you are watching this video right now and it resonates with you, write 1 in the comments. Otherwise, write 0 and tell me where you are watching from today, because your opinion matters in this conversation. Don't forget to subscribe to my channel and activate the notifications, because what I am about to reveal could literally save your life. This is not about avoiding medical care. It is about making smarter decisions. It is about understanding that the rules change when you reach 70, and what once protected you may now cause you harm. Let's discover the truth together. The hidden danger of routine medical care. Imagine Margaret, a vibrant 78-year-old woman living in Ohio. She felt very well. She gardened every day, played with her grandchildren, and had more energy than people half her age. But during her annual physical exam, her well-meaning doctor recommended some routine tests as a precaution. 6 months later, Margaret was going in and out of the hospital, weakened by the interventions, stressed by false alarms, and terrified of her own body. What happened? She fell into what I call the medical cascade, where one unnecessary test leads to another and then to another, until you are trapped in a system that cares about tests, not about the person. This is what happens to thousands of older people every single day. The medical system operates according to protocols developed decades ago, in an era when life expectancy was different and our understanding of aging was limited. But here is what they don't tell you. Your 70-year-old body has different needs, risks, and priorities than your 50-year-old body. The most dangerous phrase in medicine today is just to be thorough. These 4 words have sunk countless older adults into unnecessary medical odysseys that steal their golden years. Today we take back control. Test number 1, the colonoscopy trap that affects the elderly. Let's start with the most important one, the colonoscopy. For decades, this examination has been considered the gold standard for colon cancer prevention. But this is what nobody tells you. After the age of 75, the benefits often do not outweigh the risks. Think about it. Logically, colon cancer usually takes between 10 and 15 years to develop from a small polyp. If you are 78 years old and have already had normal screening tests, what are the real chances that a polyp detected today will affect your quality of life? They are almost 0. However, the intervention itself carries immediate and serious risks. Let me tell you about Robert, a 76-year-old retired teacher. He was lively, active, and living independently. His doctor insisted that he have a routine colonoscopy, even though Robert had no symptoms and had already had 2 normal exams. During the preparation phase that involved drinking strong laxatives, Robert became severely dehydrated. His electrolyte balance was disrupted. He fell in his bathroom at 3 in the morning and broke his hip. This fall changed everything. Robert spent 3 months in rehabilitation, never regained his independence, and now lives in a nursing home. All because of a test he did not need. The preparation alone is dangerous for older people. These strong laxatives can cause dangerous dehydration, especially if you take blood pressure medications or have kidney problems. Your body simply does not recover as before. And then there is the sedation. Anesthesia affects the older brain differently. You may wake up confused, disoriented, or with what doctors call post-operative cognitive dysfunction. Basically, your ability to think never returns to normal. Is it worth risking the loss of mental clarity to find a polyp that might never cause problems? This is what the research shows. The American College of Physicians now advises against routine colonoscopy screening in adults over 75. However, many doctors continue to prescribe them out of habit, fear of legal action, or because of outdated protocols. The smarter approach. Listen to your body. If you notice blood in your stools, unexplained weight loss, or persistent abdominal pain, consult a doctor immediately. But if you feel well and your previous tests were normal, you should perhaps seriously discuss with your doctor whether this test is really necessary. Test number 2. The full body scan, the fear machine that costs a fortune. And what else? How tempting is a machine that can look inside your body and detect problems before they occur? Well, it is not so great. Full-body CT scans and MRIs can be the most dangerous tests you can undergo at a very advanced age. And here is why. They detect everything, absolutely everything. That spot on your kidney that has been there for 20 years and has never caused any problem, the scan will detect it. That small nodule in your lung that would disappear on its own, the scan will report it. That small irregularity in your liver that is completely benign, the scan will classify it as abnormal. Welcome to the world of incidental findings. Those medical discoveries that seem terrifying but in reality have no meaning. The problem is that once something appears on a scan, the medical system cannot ignore it. Then you will find yourself immersed in a whirlwind of additional tests, consultations, and specialized procedures that can seriously harm your health. Let's take Patricia as an example. At 73 years old, curious about her health, she decided to have a complete analysis at a health fair. The results revealed a suspicious lesion in the kidney. In 2 weeks, a biopsy was scheduled. During this biopsy, her lung collapsed. A known complication, but no less devastating. She spent a week in intensive care, several months recovering, and developed chronic fatigue that never went away. The suspicious lesion was completely harmless scar tissue. Patricia traded her vibrant health for information that meant absolutely nothing. Another concern is the exposure to radiation from these tests. Although one test may seem harmless, the cumulative effect of multiple tests throughout life can actually increase the risk of, ironically, cancer. Doing tests to prevent cancer can actually cause it, but the psychological damage is perhaps the worst. Once you know even the smallest imperfection in your body, you can no longer ignore it. You worry about that spot, that shadow, that anomaly that probably means nothing, but to you it seems enormous. Test number 3, cardiac stress test on the treadmill. Your heart has been beating for more than 70 years. It has accompanied you through decades of life, love, stress, and joy. So when your doctor suggests a stress test just to check, it seems reasonable. But for many older people, this test is like using a hammer to hang a picture. Stress tests were designed to detect heart problems in younger people with symptoms. But with age, our hearts change naturally. The arteries harden slightly, the electrical patterns change, and recovery times become slower. These are not diseases, but normal signs of a heart that has been working faithfully for decades. But the stress test does not know that. It detects these changes and flags them as abnormal. This triggers what doctors call a false positive, a result that suggests problems when there are none. This is George, a 74-year-old man who felt very well. He had no chest pain, no difficulty breathing, and had a lot of energy for his morning walks. But his doctor insisted on a stress test during his annual physical. The test revealed some irregularities, not because George was sick, but because his 74-year-old heart did not react exactly like that of a 35-year-old man. 3 weeks later, George underwent cardiac catheterization. The procedure revealed mild plaque typical of his age, but the cardiologist decided to insert a stent. During the procedure, George developed a serious infection at the insertion site. He spent the next 6 months fighting complications. He lost 13 kilos and never recovered his previous vitality. But here is the worst part. Recent studies show that among asymptomatic older people, these interventions do not prolong life nor prevent heart attacks. They only create new problems. The American Heart Association now recommends against routine stress tests in asymptomatic people. Still, they continue to be performed daily across the country. Why? Because doctors are more afraid of missing something than of causing harm. Test number 4. Bone density. Source of fear of fractures. Osteoporosis is a reality, and fractures in older people can be devastating. But the routine bone density tests that many older people undergo every year could cause more anxiety than protection. Here is why this test has become problematic. First, the thresholds used to diagnose osteoporosis were established from data on young, healthy women. They do not take into account the natural bone changes associated with aging. Therefore, a completely normal age-related loss of bone density is called disease that requires immediate treatment. This leads to the prescription of bisphosphonates, medications like Fosamax and Boniva, which can have serious side effects in older adults. These medications can cause jaw necrosis, where the jawbone literally dies, unusual fractures, and severe digestive problems. Some older people end up in worse condition than when they started. Then there is the psychological impact. Receiving a diagnosis of osteoporosis when you have never broken a bone can generate fear of moving. Older people begin to avoid activities and become more sedentary, which actually increases their risk of fracture. It is a cruel irony. The diagnosis creates the very problem it seeks to prevent. Dorothy, 72 years old, had been swimming, walking, and gardening for years without any problem. After a bone density test revealed severe osteoporosis, she developed a panic fear of falling. She stopped her activities, began taking bisphosphonates, and developed severe acid reflux and muscle pain. In a matter of 1 year, she had become fragile and fearful, not because of her bone disease, but because of the fear of it. Test number 5. Systematic cancer screenings after the age of 75. This is perhaps the most controversial issue, but it is essential to address it. Routine screening tests, cancer screenings such as mammograms, PSA tests, and cervical cancer screenings can do more harm than good to people over 75. Here is the uncomfortable truth. Most cancers grow slowly, especially in older people. Many cancers detected in people over 75 would never have caused symptoms or affected their quality of life, but their detection triggers aggressive treatments that can be devastating for aging bodies. Let's take mammograms as an example. Exposure to radiation accumulates over time, and some experts believe that decades of routine mammograms can actually increase the risk of breast cancer in older women. In addition, mammograms often detect ductal carcinoma in situ, DCIS, abnormal cells that may never become invasive cancer, but once detected, they are treated as aggressively as true cancers. Eleanor, 78 years old, had been having mammograms for 30 years. Her last exam revealed DCIS. Although they told her it was a precancer that might never cause problems, she was subjected to emergency surgery, then radiation therapy and hormonal therapy. The treatments left her weak, exhausted, and depressed. She often wonders if it would not have been better never to have known about those cells that might never have caused harm. The key word here is might. At 45, it makes sense to treat something that might become cancer in 20 years. At 78, you undergo treatments that will surely affect your quality of life to avoid something that might never happen. It requires careful reflection about life and the wisdom of making another decision. Before you think I am advocating neglect in medicine, I want to be very clear. I defend wise medicine. There is a profound difference between giving up on your health and refusing to let the medical system control your life. After the age of 70, your priorities must change from disease prevention to preservation of your quality of life. This means focusing on the symptoms that are really affecting your well-being and your functioning, instead of looking for abnormalities that only exist on paper or on scans. Smart healthcare after 70 means listening to the body, not to the machines. If you feel well, you have energy, and you can do what you love, that means more than any test result. Ask the right questions before accepting a test. Will this change my health or my functioning? What will happen if we find something? Does the test involve any risk? What will happen if we do not do this test? Understand that normal aging is not a disease. Your 75-year-old body is not supposed to function like that of someone 25. Some changes are natural and do not require any intervention. Your health, your choice. To conclude, I would like you to understand one fundamental thing. Taking control of your health decisions does not mean giving up, but living according to your values and wisdom. You have earned the right to make informed decisions about your body and the years you have left. The medical system will always want to do more tests, find more problems, and offer more treatments. But you have something it does not have: the wisdom that comes from 7 decades of life experience. Use this wisdom. Trust your instincts. Honor your values. If this video has opened your eyes to a different way of thinking about medical care after the age of 70, I would love to know your opinion. Leave a comment below to tell me which of these tests surprised you the most, or share your own experience with excessive medical tests. Your stories are important. They help other older people make better decisions.